Hey guys, let me teach you about nasal polyps in this podcast. So, what are polyps? Polyps are hypertrophied edematous, non-neoplastic, prolapsed mucosa of the nose and paranasal sinuses. Okay, so what are the types of polyp that we are going to talk today? So, there are basically two types of nasal polyps that we'll be talking in this podcast. The first one is ethmoidal polyp, whereas the second one is antrochoanal polyp. More about this in the later segments. The two types of polyps, antrochoanal polyps and ethmoidal polyps. So what are few differences between them? Basically, antrochoanal polyp is more common in children or young age groups, okay, whereas this ethmoidal polyp is more common in adult side of age group. The most common cause of antrochoanal polyp is basically infection. Okay, infection may be bacterial infection or viral infection. These are the causes of antrochoanal polyps, whereas for the ethmoidal polyp the most common cause is allergy. Antrochoanal polyps are usually unilateral and these are solitary in number, whereas these ethmoidal polyps, as these are caused by allergic rhinitis or allergen atopic conditions, these are bilateral, these are multiple in numbers, and these are mostly found around the ethmoidal sinuses area, whereas these antrochoanal polyps, these are found in maxillary sinuses and near the ostium. The growth of antrochoanal, as the name suggests, antrum to choana, it grows backward from the maxillary antrum to the ostia, okay, whereas the ethmoidal grows inward. Ethmoidal polyps are usually small, grapes-like, and multiple in numbers, and when they are removed surgically by polypectomy or ethmoidectomy, the chance of recurrence is common, okay, whereas in antrochoanal polyps the chance of recurrence is very low when it is surgically removed. The treatment of antrochoanal can be by the surgery alone, whereas in ethmoidal polyp, how do we manage them? We manage, since it is caused by allergy as well as there is mass growth, we need both medical treatment and surgical treatment for the management of ethmoidal polyps. In the medical treatment, we basically give antihistamine, we control the allergy, and we give corticosteroids, which may be topical or intranasal steroid. So these are a few differences between antrochoanal and ethmoidal polyps.